Today I will be talking about the use of Meloxicam to treat osteoarthritis in cats. The cause of osteoarthritis is often unknown, but the end-stage disease is the same. A decrease in proteoglycan content in articular cartilage leads to chondromalacia, degeneration of cartilage, and death of chondrocytes. This degeneration activates macrophages, which will secrete interleukin-1 and tumor necrosis factor alpha. This will then promote the secretion of prostaglandins, which will induce inflammation and pain, as well as inhibit proteoglycan synthesis, which will lead to a cycle of degeneration. Meloxicam is an oxycam in the class of non-steroidal anti-inflammatory drugs. Its mechanism of action is to selectively inhibit COX-2. This inhibits the production of prostaglandins from arachidonic acid at sites of inflammation, while having minimal effect on COX in the kidneys and gastrointestinal tract, thus reducing the risk of adverse effects. Inhibiting production of prostaglandins will reduce the induction of inflammation and pain. There are many decent studies showing the efficacy of long-term treatment of osteoarthritis in cats with Meloxicam. I will go over two of them briefly. The first one is an experimental study in which 8 healthy cats were each given a different dose of Meloxicam for 4 days, including 2 cats that were given a placebo. Then synovitis was experimentally induced into one of their stifle joints. The efficacy of Meloxicam's analgesic properties were assessed objectively and subjectively. Here's an illustration of one of the objective measures, contact pressure. As you can see from the graph, the cats that were given the placebo were most reluctant to put weight on the affected limb, while cats treated with Meloxicam were willing to put more pressure on the limb. The strengths of this study was that it was an experimental study, so the researchers had more control, which meant less possibility for confounding variables, and they used objective measures. The biggest weakness of this study was that there was a risk of bias because 2 of the authors were employees of Boehringer Ingelheim, the manufacturer of Meloxicam. The study was also funded by them, as is most of the available published literature on Meloxicam. The second study is a prospective clinical trial in which there were 2 groups of cats with osteoarthritis. One group was treated with Meloxicam daily, and the other group was treated with glucosamine chondroitin daily. Owner-assessed mobility scores showed that Meloxicam is effective in improving mobility and activity levels in cats with arthritis, while glucosamine had no significant effect. The strengths of this study was that it was double-blinded, randomized, placebo-controlled, and there were no conflicts of interest, no connection to Boehringer Ingelheim. The weaknesses of the study was that there were low patient numbers and that there was a lack of objective scoring. It is worth mentioning that long-term use of Meloxicam in cats in the United States is off-label use only, as there have been some incidences of renal failure and death. However, the evidence has primarily been anecdotal. Since then, many studies have been published showing the safety of long-term use of Meloxicam in cats. And long-term use in cats is registered in many countries, including Australia, New Zealand, the UK, and Europe, with few adverse reactions reported. However, there is still a risk. The best vets can do is to assess the risk and to try to minimize it by taking the appropriate measures, such as using the lowest effective dose and regular monitoring. Thank you.